Time for PetSylvania with Dr. Bob Esplin. Dr. Bob guides you through the latest veterinary techniques and procedures to keep your pets in the best of health. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. With your ears up and tails wagging, here is Dr. Bob.
Here we go with PetSylvania for another week, and I'm sure glad to be here. Glad to be bringing you pet information. I really would encourage you to please send me some questions. It makes it more interesting at both ends here if I can answer a specific question for you. I'm really proud to have 4 high-quality sponsors for PetSylvania. Hills, the makers of high-quality premium dog and cat food. Their newest foray into the pet store line is a product called Ideal Balance. It's a grain-free diet. We've now filled the niche of grain-free diets for those of you that would like to avoid grains for your pets by a company that has the highest standards of the profession, that does nutritional research. I can now have confidence in recommending a grain-free diet where before I was never confident recommending a grain-free diet because I literally don't know who makes the foods that are advertised on TV. And we don't know about their quality control. We don't know about the quality of the ingredients they use. I can assure you that Hills uses the highest quality ingredients, and their quality control is stellar. Elanco, the maker of Trifexis and Comfortis. Comfortis is a once-a-month flea pill. We will use that quite a bit on cats right now if we start seeing fleas on cats. But our primary recommendation for the Elanco product this time of year is Trifexis for dogs. It does 3 things: heartworm prevention, internal parasite prevention, and flea prevention. Your dog should be on all 3 of those year-round, but if you haven't been doing it, I want you to get started on Trifexis. I want to encourage you and challenge you to find anybody that sells that product at a lower fee than we do, because we want to make these products for you affordable so that you can safely use them and that you can use them to protect your animal. Our profitability is based in other ways rather than doubling the cost of the Trifexis as it comes from the manufacturer Elanco. So check us out. Check out Trifexis. You're going to be really impressed. It's a pill, nothing topically. Is that not cool? Esplin Medical, the maker of a premium, high-quality, environmentally friendly surgical scrub, 55% bamboo, 25% cotton, only 20% polyester. They are the most comfortable scrub that you have ever worn. They will hold up. They clean in cold water. They dry on air fluff. It's another environmental positive for them, and are naturally antibacterial, and it's like wearing pajamas when you're in your scrubs. The other scrubs that are out there, you almost have to wear an undershirt because they, no matter how many times you've washed them, they're still coarse. Might as well wear a burlap bag, wearing some of those lesser scrubs. If you got to work in them all day for an 8-hour, a 10-hour, or a 12-hour shift, don't you want to be comfortable? Buy a premium quality product. Buy Esplin Medical Scrubs. Check that out at esplinmedical.com. Also sold in the Toledo area at Toledo Family Pharmacy, and they'll be sold at the Westgate Family Pharmacy, and they are also going to be sold at Sylvania Vet. So come check them out. And then Sylvania Vet, my business. I'm still on my health hiatus here, but they're hard at work and maintaining the standards that we've all established. We're there for you 24/7, 365. Call us anytime, 419-885-4421. Check out our website, sylvaniavet.com. Take a tour. We have the best medical library you could possibly have. If you need to do research for a pet's condition, this is a great place to go because you're going to get scientific information. You're not going to get information off of Wikipedia. You're not going to get that information off of blogs and other non-scientific information sites, particularly if you're shopping for foods. That would be a great way to use our website as well. We send a monthly electronic newsletter. You may register. It comes to you for free. Just go to the left-hand corner of the landing page, put your email address in there, and then we will be happy to send that to you every month. I think you'll find it interesting. Where this is my electronic newsletter here in PetSylvania, we call FYI for Pet's Sake the electronic newsletter that we send. Cats get a heart condition called cardiomyopathy. And just by definition, cardio means heart. Myopathy means myo means muscle, and apathy means pathology. So we have heart muscle pathology. We have heart muscle disease. There are three basic forms of cardiomyopathy in cats. Hypertrophic cardiomyopathy, where the left ventricle, the heart becomes muscle bound and the chamber on the inside becomes too small and can't hold all the blood. There's restrictive cardiomyopathy, where the heart basically becomes stiff, kind of like my knees, and won't contract properly, and that causes severe problems. And then dilated cardiomyopathy, where the exact opposite of hypertrophic happens. The walls of the left ventricle thin and lose their strength. The major cause of that is a deficiency of an essential amino acid called taurine. So we don't see DCM as much anymore because most cat foods are supplemented with taurine. For whatever reason, you're letting your cats eat primarily your dog's food, and it's not eating significant cat food, and it's not eating any meat. There's a decent chance it could have taurine deficiency. You need to be careful about that. Only about 60% of cats with cardiomyopathy have a murmur. And so without a murmur, there's very little that we can do to detect that problem might be there. Signs that at home, there just aren't many. You might see increased respirations. You might see limb weakness, and you might see fluid buildup. But these are all when the disease is really progressed to a level where it's really severe. There are no preliminary clinical signs that you can pick up on. Unlike me, where I had a stress test and they found my heart vessel problems, there is no stress test that we can put a cat through to find that. So the only way to determine if your cat has cardiomyopathy is with ultrasound imaging. That's an expensive endeavor. It's not something that the average practitioner should do. That really should be done by a veterinary cardiologist, and a veterinary cardiologist only. None of us in the practice world are qualified and have the necessary expertise or experience to do that. If we suggest you go see a cardiologist for an echo, don't look around for somebody else that might be able to do it cheaper. You're really going to get your money's worth. There's no question about that. There's no great consistent treatment, and there's nothing that we can do to prevent this. This is really, maybe in the future we'll have some things other than being sure that your animal isn't taurine deficient. There's really not much we can do. It's a roll your dice kind of a thing. Many people may have gotten rabbits for Easter. Rabbits are becoming more and more popular as pets. They're pretty fun to have around, and they can be trained to use a litter box. They can be spayed and they can be neutered because they will do some of the same things that intact cats will do. And so you can do all that. But one of the things that is really true about a rabbit is that they are very, very susceptible to spinal injuries. Are wiggle worms, and if you pick them up and carry them and you don't have a solid hold, they could easily jump out of your arms. And in doing that, just the act of jumping may cause them to injure their back, literally dislocate a vertebrae or break their back. But when they land, there's a pretty good chance, because they overflex the back, that it could break. So proper handling of your pet rabbit is extremely important. And I would Google the House Rabbit Society and find a local organization where there'll be some informative information for you on your rabbit. But I would strongly encourage you to call 419-885-4421 and schedule an appointment with Dr. Andrea or Dr. Melanie to discuss this and proper handling, teach your children how to properly handle, and other husbandry issues. Once an animal's paralyzed, we're not going to get through that, and they're going to have to be euthanized. Time for a break. We'll come back on the other side. There's a condition in growing dogs that's called elbow incongruity, and we see it most often in dogs that are what are known as chondrodysplastic. They have the short, stubby legs like the Dachshund and the Basset Hound, but I've seen it in a Kutan, and I'm going to tell you a story about a Kutan, and I've seen it in other breeds of dogs as well. And so when we see a young growing dog and they have pain in their elbow, one of the things that enters our mind is that we're going to look for incongruity. We're also going to look for some other conditions conditions called a fractured coronoid process or an ununited ankylosing process. These things are all events that can occur in an elbow in a young growing animal. The only real sure way to determine that your animal has incongruity of the elbow is with a CAT scan or an MRI, and that gets awfully expensive. But the reality is that we can, with good x-rays and taking enough views, we're able to diagnose most of these conditions. And what we generally do is that we take a number of views, and then we want to send unless it's really obvious when we look at it, if there's uncertainty, then we want to send those x-rays off to a veterinary radiologist, a board-certified individual whose whole career is based on reading x-rays and who has a much greater experience than those of us in the practice world. We want them to go off and read those, and we're able to then make a determination. If there is elbow incongruity, the sooner we do something about it, the better off we are, because we want to reduce the leveraging pressure that's going on. And the bones of the body are, when you have an incongruous elbow, are leveraging the elbow to almost dislocate it. There's a couple of ways. If we refer you to a board-certified surgeon, they're going to do some very sophisticated procedures to the legs to lengthen the radius. And doing that takes the pressure off of the elbow. A procedure that I've done several times, and it truly has helped, in this little couton that I was going to tell you about, a little white, cute little morsel. What we did is we went in and we took a small piece of its ulnar bone, which is the other bone, the radius and the ulna in the front legs. And we took a small piece of the ulnar bone out. That relieved the pressure, and now the dog gets around and is able to be pain-free, has not developed a lot of arthritis in that joint because we got it early, and it worked really great. So I'm really happy that we did that, and it's something for us we'll be talking about if we ever make a diagnosis of elbow incongruity. Diabetes in dogs. Diabetes is a disease caused by an insufficiency of a hormone produced by the pancreas called insulin. In the case of a dog, it's like type 1 diabetes in humans. It's insulin dependent. What happens when you have diabetes, without enough insulin, there's a lot of blood sugar circulating in the blood, but it can't get into the cells. So the cells are starving. There's plenty of meal there. It'd be like having your mouth taped shut and having a nice juicy steak sitting in front of you. It wouldn't do you any good in a situation like that. What we have to do in that case is that, the diagnosis of that is based on lab work, clinical signs of increased water consumption, increased appetite, probably weight loss, low energy. We see that a lot. There just isn't enough fuel in the cells for the animal to be energetic. Then we start insulin injections, and we oftentimes start a high fiber diet, which helps us manage the disease and not have to use as much insulin. So that's beneficial. We monitor the diabetes and how we're doing in a couple of ways. One, we do a blood test called a glucose curve, where we do a blood sample every 2 hours and we see how the insulin is affecting the blood sugar, or we do a blood sample called fructosamine, which is basically an average of the blood sugar over a 2-week period. So in an animal who gets really excited, real stressed, owners who don't want their animal to be away from home for a whole day and in the hospital, the fructosamine is a great test. We base a lot on clinical signs as well. How's the dog doing at home? How's that water consumption? How's the appetite? Have we gained a little back, or at least if we stopped losing weight? Is our appetite good? Is our energy level up? All right. Those are all things. Obesity predisposes to diabetes in both dogs and cats, and in people for that matter. So diet control, keeping weight under control is extremely important. I was reading a journal here recently, and one of the really cool things that I learned relative to diabetes is that there is some studies being done on gene therapy and producing a gene that can be injected into a pet's muscle. Injecting that into the muscle, that muscle then starts producing insulin because of the way it reacts to that gene that was in it. The gene, they call it the canine proinsulin gene, and it's got a fancy gene name. So then what happens is that that muscle, it starts producing it. What they didn't explain is how the body tells the pancreas to stop producing, but it could be an alternative treatment in the future, and certainly it would have tremendous applicability to humans if they're able to accomplish that. A recent study I read, and we've talked about this several times in the past, and that is, how do you test for food allergies in animals? And a study did an extensive extensive research and review, and they determined that blood tests and patch testing for food allergies is absolutely unreliable and should never be counted on to choose the proper hypoallergenic diet. And another study that I read causes some concern in that they were able to take some of the diets that are on the shelves in the pet stores and even on the shelves in veterinary practices that are supposedly hypoallergenic and find a significant parts per million of some of the things that we're trying to eliminate. And so that creates a real problem. So from my perspective, I think things that I have been recommending more and more is that we use for a period of 10 to 12 weeks homemade diet with a unique protein and a unique carbohydrate source. And we do that. That way we're able to verify or eliminate food as an allergy. We do know that about 10% of the dogs out there have some kind of an allergy, but less than 10% of those have food allergies. So food allergies should not be right at the top of our list when we start talking about allergies in dogs. Gastroesophageal reflux disease is something that affects a tremendous number of human beings, and it's like really severe and advanced heartburn. Among one of my few medical problems before I had my heart experience here is the fact that I, in fact, have GERD, and it's not very pleasant. Dogs, it's been determined now that dogs, in fact, get GERD as well. And at its worst, dogs can have a chronic cough, they can gag, they can have a change in their voice, there can be laryngeal swelling of the voice box, they'll have excessive panting, and they may have intermittent vomiting and diarrhea. They may have ulcers in their stomach, they have ulcerated esophagus from the reflux as well. So as a result, that can be a way to approach a dog with chronic vomiting, something to think about, a dog with a chronic cough that we can't diagnose anything wrong with the respiratory system, a dog who seems to have suddenly developed laryngitis. Maybe all we got to do is treat their gastric reflux disease, let that the esophagus and the back of the throat heal, and they'll get better. And a study that presented that determined that exact thing. We're going to take a break now and come back on the other side and finish up. All right, we're back to wrap up today's show. And one of the things that I wanted to mention to you is all the rescue organizations do early age spays and neuters. I understand their motivation, and I know that they have lots of documented evidence that proves that it's okay. But quite frankly, there are things about it that truly concern me. And if you get us an intact puppy or kitten, we are not going to recommend that it be done at an early age. And I would strongly have you consider why that's a bad idea. Puppies and kittens, when they're anesthetized, their blood pressure is going to drop. And it may cause damage to the kidneys or other organs that we won't know for 8 or 10 or 12 years, and we won't know how to blame it on that early age. But most of the time, these animals that are being done are not being put on fluid support and done anything to help maintain their blood pressure. They're so small, a blood pressure cuff won't even fit them, so it's very difficult at the best to even try to track it and be sure that the blood pressure doesn't drop. Those young ones, really young ones, under 3 months, their respiratory system is really immature, and so you're putting a lot of stress on that. Their blood sugar drops. They've been fasted a little bit. Their blood sugar drops. That can cause problems, including brain damage, and their body temperature drops, and they can become hypothermic, and that can cause troubles with recovery, and it can have long-term consequences as well. So I think that the key is that under the best of circumstances, I would recommend that an animal not be spayed or neutered at a really young age. The long-term consequences of this we don't know about. I mean, it just hasn't been studied well enough, and in many cases there isn't enough long-term in there. But there is some thought that there may be bone and joint problems that develop in these dogs and cats that have early age spays and neuters, that their legs may grow longer than their body is designed for, which puts inordinate pressure on their joints, and it might account for the tremendous increase in cruciate ligament ruptures that we're seeing. And we don't know about the development of the urinary tract and if that might have an impact on a cat, particularly the size of the penile urethra, and where that may lead to urinary obstruction problems. I want to talk a little bit about our seminar later this month. It's going to be 7:30 p.m. Wednesday, April 24th. Dr. Jen Tate's going to be presenting. She was a member of a VMAT team that was deployed to Hurricane Charlie and also deployed to Katrina. She's going to talk about her experiences there and how things have changed a little bit since then, so that animals are welcome in some of these shelters that are opened up for, like in Florida, if there's a hurricane coming and they have shelters. She's also founder of the local DART team, which is a disaster animal recovery team, and she's a member of, in good regard with state, and they're in the VMAT portion of that. So come to that presentation. I think you'll find it extremely educational and very interesting. She has a great presentation that she puts on. I'd like to thank Elanco, a maker of Trifexis and Comfortis, for sponsoring me. Esplin Medical, maker of premium high-quality bamboo cotton polyester scrubs. EsplinMedical.com. Hills for their sponsorship, and I want to promote their product, Metabolic Diet, the newest diet, a game changer in weight loss in dogs and cats. It's really essential that you get your overweight dog scheduled to have a consult so that it can be properly put on Metabolic Diet, and you can see the benefit of feeding that diet versus anything else, but particularly if you've tried to diet your animal and it has failed. Sylvania Vet, I want to just thank them for being there for me while I'm off on my health break here and I'm recovering from my open heart surgery. I'm forever grateful to them and my staff, all my doctors and the rest of my staff, for carrying the ball and relieving any stress that I might feel by not being in there working. I certainly miss my patients. I miss my clients. I miss my staff, but it's necessary, and I hope by middle or so of May I'll be back and I'll be better than ever. With that said, there's only one greatest pet, and it lives in your home.
You have been listening to PetSylvania with Dr. Bob Esplin on WSYLradio.com. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. Tune in every Saturday at 10 a.m. as Dr. Bob explains the latest in veterinary care and answers your questions. You can email your pet questions to requests@WSYLradio.com, and Dr. Bob will answer them on a future show.